So we're back from the break. It is now my pleasure to chair the session focusing on raising awareness of retinoblastoma and its early signs, which is very close to my heart. And we know that it can be diagnosed at an earlier time, and we know that early diagnosis gives the child the best chance of survival, of saving their eye and their sight. Hopefully we'll be able to have some time for questions at the end of the presentations.
Maxwell. I'm from the Childhood Eye Cancer Trust in the UK. I'm here to speak about raising awareness on small budgets. I know that we are a global audience here, so I thought it would be helpful to give you a bit of background on retinoblastoma in the UK. Around 40 to 50 children are diagnosed annually in the UK, which equates to around 1 child a week. We have really good survival rates. Around 98% of children will survive the condition. But sadly, around half of those children will have an eye removed. And we all know that the long-term effects of retinoblastoma can last well into adulthood for many affected children. The Childhood Eye Cancer Trust, or CHECT, is a UK charity supporting anyone affected by retinoblastoma. We provide support and information to families and individuals. We raise awareness amongst healthcare professionals and the public to help drive early diagnosis. We fund research into the diagnosis, treatment and impact of RB, and we influence policy to improve services for RB patients. In the UK, as elsewhere, of course, RB is a rare condition. There is no population screening of newborn babies. Where a family history of RB exists, then screening is possible for those newborns. But in general, we are reliant for diagnosis upon parents and healthcare professionals recognising the subtle signs and symptoms of retinoblastoma in a child's eye. Our own figures show that just 20% of parents of newly diagnosed children had any awareness of retinoblastoma, and around 44% of children with retinoblastoma were diagnosed in the appropriate 2-week urgent referral period, which shows there's a lot of work to be done still in this area around raising awareness of the signs and symptoms of retinoblastoma with parents of young children and healthcare professionals in order to make sure we're driving earlier diagnosis for more children. We have our challenges. We are a small charity. We have 9 staff, half of whom are part-time. We don't receive any government funding, and we're entirely reliant upon voluntary donations to carry out our work. Around 20% of the charity spend is on awareness. This is mostly on salaries, so we don't have big advertising or marketing budgets. Our main asset is the amazing relationships we have built up with people over the years. Most of the individuals and families affected by retinoblastoma in the UK are members of the Childhood Eye Cancer Trust. And they really are the most powerful resource. They are really passionate about raising awareness through sharing the stories of their RB journeys. So we channel our energies into 3 main awareness points in the year: Rare Disease Day, World Retinoblastoma Awareness Week, and Childhood Cancer Awareness Month. And the main routes we use to try and get those stories out there, mainly aimed at parents of young children, are through traditional media, newspapers, magazines, TV and radio, and of course social media. And we mainly use Facebook, Instagram and Twitter. And both these routes are completely free of cost. It's just really the time resource of approaching, for example, newspapers and magazines to see if they're interested in the story, or writing up blogs for your website, which then can be shared on social media. And we very much focus on the signs and symptoms to raise awareness. So it's really important to have good photos to go with these stories, of families who are happy and ready to speak to the media. I think this is a really important point to make sure that it's the right time for families. Shortly after diagnosis is not the right time. They need to have got past that initial whirlwind of treatment and the shock to have reached a point at which and it can be a very cathartic thing for families to do, where they are happy to share their stories in order to help others. And here are just a few of the cuttings we've got of print and online media stories that have come from members sharing their experiences. You can see some very striking white eye photos, for example, that I think really stay with readers after they've they've read the article. People very much retain that if nothing else, that realization that if they see white eye in a photo, it's something that needs to get checked out quickly because it is something serious. At the other end of the scale, it can seem old school, but distribution of leaflets and posters in the community can be really effective. The cost of printing has come down a lot in recent years. So much of design can be done in-house. You may find even that local businesses are willing to do a print run for you. So it's completely free of cost. And again, just use your supporters to get those leaflets and posters out into the community. As I say, it can seem old school compared to some of the digital resources we're used to these days, but I can immediately think of one family where the child's diagnosis was aided because mum had seen a poster in the local health centre. So get those leaflets out there to schools, health centres, libraries, anywhere where parents and young families are going to be. And we also have targeted GP and optician packs that we get out there as well. I've mentioned corporate support a couple of times already. I think it's really important to recognise that corporate support can be so much more than fundraising. Two relationships that have been really important for us in recent years have been with MMR Research and a digital agency called Wonderman. Both came through memberships, through our members. MMR were introduced to us through one of our trustees. And over the years, for 4 or 5 years, they have carried out free of charge surveys for us. You know, those surveys where either it used to be that people called you up, say, oh, can you spare 10 minutes to answer some questions? Now, I think they're mostly done online, but to track general awareness with parents of young children of general eye health and retinoblastoma in particular. And we use that information both to inform the work that we do, but also as the basis for media work going forward. It's always so useful to have new figures to promote your messages that you're talking about. Wonderman, we're a digital agency. One of our members worked for them and put us forward as Charity of the Year. We actually ended up staying with them for a number of years, but I think one of the most striking projects they did, which many of you may have seen, was they designed these incredible interactive posters whereby if you took a photo with your smartphone using the flash, it recreated that white eye that so many parents, it's the first symptom that they see. And then they created an amazing video that went with it. And with their reach, we're able to get that video so widely spread on social media that actually it did go viral. And I checked just before putting this presentation together. To date, the video has had 1.3 million views. Something we just never ever, we couldn't have created a video of that quality, but that reach as well, we just couldn't have achieved on our own as a tiny charity. So, you know, it's always worth researching who you know, where they work, are there any opportunities there, because it really can help you reach much wider audiences. And I've just put the link there to the YouTube video in case you haven't seen that before. It really is worth a watch. Another completely different kind of awareness raising, again, using your networks. One of our young members worked for an MP in the UK Houses of Parliament, and she got in touch to let us know that they were able to organise free awareness events for other MPs from that position. And we were delighted. We took up the opportunity. It's something we've never done before. It's really exciting. Allowed us lots of opportunities for members to get involved, to send template letters to their local MPs. We got members along to the awareness event, aged from, I think the youngest was 3-year-old up to trustees. I'm not going to say how old they are, but we had a whole range of ages there for members to talk to find out about retinoblastoma. And then we asked them to take photos to share on their social media, and just, again, reaching audiences that we couldn't make alone. So alongside targeting parents of young families, the other main group that we want to reach are healthcare professionals. In the UK, the 3 main groups that parents will contact in the first instance are the family doctor, general practitioners or GPs, high street opticians, and health visitors who mainly are involved with children under the age of 2. And when we started to really look at targeting these groups, we realised it was really important to quantify the issues that we knew anecdotally were occurring. So the delays in diagnosis, the variance in referrals by professions. So we started recording information from conversations with families of newly diagnosed children, and we call this information pathways to diagnosis. We've been recording it since 2012, so we've got 8 or 9 years worth of information now. And this really, as I said, quantifies the issues that we know are out there. And by having now a few years of figures, that because you are dealing with small groups of people each year, you're going to get annual fluctuations. But when you get to 8 or 9 years worth of figures, some of those fluctuations are ruled out so that you see stronger trends. Again, with healthcare professionals, really important to use a whole range of approaches. We use our figures to get articles into trade media. We get our information into GP training events as part of delegate packs. As I mentioned earlier, we have targeted information packs our members distribute to local GPs and opticians. And of course, we use social media as well. In the past, Facebook and Twitter, and we're really trying now to exploit LinkedIn more to build those relationships with GPs in particular. We've had some great industry support. Vision Express are a big optical branch in the UK, and they're part of Grand Vision globally, you may know that name. They've worked with us for a number of years. The main way that we've worked together is on creating something called the Opticians Protocol, which is sort of guidelines for opticians and other staff in practice to help recognise red flag symptoms and get children referred on even quicker. We also worked with Vision Express to produce an e-learning video to go with that. And they use that internally, but also have been really instrumental in getting that industry-wide across optometrists. And that really is, again, something we couldn't do ourselves. We've also worked with other childhood cancer charities and industry bodies such as the Institute of Health Visiting, just seeing where we can partnership up to achieve more bang for our buck, if you like. So with all this work, and particularly when you have limited resources, it's so important to count what you're doing to see what works. It can be so tempting to get caught up. You want to be doing the doing rather than sitting back and doing the boring work of counting, but it really is important to quantify it. We've mentioned a couple of the surveys we do with on an annual basis with the general population and new families to track awareness trends, to see where families get their information from, to know where we should be putting our efforts. Social media and the websites are wonderfully countable with clicks, likes and shares. You can count visits to websites. You can monitor the number of visits to specific website pages to see how you're doing. But always recognising there are some activities which are still worthwhile doing, which are really very difficult to measure without putting a lot of money and effort into it, such as distribution of leaflets, but they can still be very well worth doing. So all this counting, the reason, of course, is because we're trying to measure the impact of what we're doing. And I hope the next slide gives a little bit of indication of how we think we are making an impact on earlier diagnosis in the UK. So again, this is based on the figures that we track in our Pathways to Diagnosis surveys. The blue line here is parental awareness of retinoblastoma. The red line is urgent referrals by GPs. And the green line is the number of children diagnosed between that, in that crucial 2-week referral period. I think we can all agree to ignore the 2020 figures at the end there. It's such an unusual year. And you can see with these lines, there are annual fluctuations. It's not just a straight line, but overall the trend in all these areas is up to show that we really do feel we are making an impact in driving earlier diagnosis through raising awareness of signs and symptoms. So my main recommendations would be going forward to really, first of all, really focus your resources on your aims and your audiences. What do you want to achieve and who do you need to get your messages through to do that? For us, we want to raise awareness of the signs and symptoms with parents of young children and healthcare professionals in order to drive earlier diagnosis. We're very clear that that's what we're doing and that is behind everything that we do. We have found it really helpful to quantify the issues that we knew existed anecdotally. And we've started small by just speaking to the families whose children are diagnosed each year, and gradually building on that each year till you're getting quite a clear picture of what's happening and where the gaps are occurring. And I think it's really important to mention at this juncture, it's not about pointing fingers of blame or trying to shame people. It's really about working together with healthcare professionals and parents to say, these are where we know the gaps in information are, and this is where we think we can help you to do better. And of course, then families sharing their stories really brings the emotion and that real life experience that's behind all those figures. And that's what we're all people, that's what we all relate to, that's what we remember, these stories of these incredibly brave families who want to do so much to help others as well. When you don't have a lot of money to spend on advertising and marketing, it's really important to use your relationships and networks, to just use any opportunity you can that's out there to get your nets wider and wider, especially when, like us, you're a very small organisation. Make sure you're using a whole range of resources. Don't just rely on one thing. And right from the beginning, decide how you're going to measure your impacts. I hope that's been helpful. I'm really sorry I can't be here to present live, but it is the middle of the night in the UK at the moment. But if you do have any questions, I appreciate it was quite a whistle-stop tour here. Do use my email, get in touch and ask me. I'd love to hear from you, and if I can help in any way, I will. Thank you very much.
Well, that was a great presentation from the team at CHECT, who have been prolific in the UK for a long time now, with lots of ideas that we all in our own corners of the world can build on. They've given us the roadmap of what to do and what works, and importantly, how they've used their data to support ongoing strategies to raise awareness, particularly with healthcare providers, because that's what makes any awareness initiative sustainable, demonstrating that it works and that it makes a difference. So we're now going to go back to Jo Croft, who I introduced earlier from Sight for All, and she's going to give us an overview on how teaching the world to see Sight for All's work, raising awareness of retinoblastoma. Thanks, Jo.
So yes, thank you for the introduction, and thank you to everyone involved in organising this wonderful conference. So as Sandra mentioned, my name is Jo, and I am an eye health educator working with Sight for All. I also work as an optometrist in private practice outside of my work with Sight for All. So I'm speaking with you today from Adelaide, South Australia, and Sight for All acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So today I'll be sharing with you Sight for All's work in raising awareness of retinoblastoma. Who is Sight for All, you may ask? Well, we are a not-for-profit organisation that raises funds to deliver eye healthcare projects free of charge to our partner countries and communities. Sight for All was founded in 2009 by 3 South Australian ophthalmologists. Dr. James Mukey was one of the founding ophthalmologists of Sight for All and is the current chairman of the board. Dr. Mukey is an ocular oncologist, and he was awarded Australia's most prestigious honour and recognised for his humanitarian work through the Australian of the Year accolade in 2020. So here he is pictured on the slide, accepting his award, smiling at the audience and displaying great pride and excitement. Sight for All's vision is to create a world where everyone can see. Our mission is to provide a sustainable model of awareness, research and teaching for sight. And our purpose, therefore, is to produce the smarts that enable whole countries to eliminate blindness. And we use SMART as an acronym for Sustainable Awareness, Research and Teaching for Sight. Now, our volunteer teams, whom we call visionaries, have been or are currently involved in delivering eye health projects in 11 different countries. And our projects are based on 4 fundamental humanitarian strategies of collaborative research, infrastructure support in the form of clinical and surgical ophthalmic equipment, sustainable education, and eye health awareness. So much of our work involves training ophthalmologists in subspecialty areas of clinical expertise. In the past, this has involved the ophthalmology fellow travelling to another country or having a Sight for All visionary provide training in country. With the advent of the COVID-19 pandemic and limitation of travel, Sight for All has now developed an online ophthalmology teaching program. So more specifically today, I'll be sharing with you all 3 projects that have involved improving the awareness of retinoblastoma and other childhood eye and vision conditions. The first project is in Cambodia, and here I have a picture of our Cambodian country officer who is displaying information brochures onto a table in a hospital clinic. The next project I'll be sharing about is based in Australia, and I have an image here of a logo titled Open Your Eyes, which is the name of our awareness campaign. And lastly, I'll be highlighting a short documentary that was filmed in Vietnam, and pictured above the title Vietnam is an image of the film director Lara, and she's crouching down and has 3 young Vietnamese children standing in front of her. So firstly to Cambodia. Over the past 6 months, we have been implementing the Cambodian Early Childhood Eye Health Awareness Project. This project is a multifaceted strategy to increase referrals of children with blinding conditions. Now, Sight for All has been providing services in Cambodia since 2009. The involvement began with a childhood blindness study, which revealed that half of all childhood blindness in Cambodia is avoidable. Common diseases include cataract, strabismus, and retinoblastoma. Since then, Sight for All has trained fellows and provided clinical infrastructure in multiple ophthalmic subspecialty areas, including paediatric ophthalmology. We understand that retinoblastoma survival rates are unfortunately much lower in Cambodia, primarily because of the advanced disease at the time of presentation and a delay in diagnosis. So our project here aims to educate frontline healthcare practitioners from Phnom Penh, training them to correctly identify conditions and initiate timely referrals to paediatric ophthalmologists. This has been an immensely collaborative project that has involved connections with multiple stakeholders, including the Cambodian Paediatric Association. One of the activities within this project was the development of a clinical resource which provides referral details for the Sight for All trained paediatric ophthalmologists based at the Khmer Soviet Friendship Hospital in Phnom Penh. The brochure, which I have displayed examples of on the slides, was made available in English and the Cambodian national language of Khmer. The front cover reads, Childhood Eye Health in Cambodia, referral information for health professionals. And the inside pages provide the names and phone numbers of the paediatric ophthalmologists, which serves as a convenient chairside reference to assist paediatricians in their referral of patients who present with suspected ocular conditions. And in communications with these health professionals, we've also shared with them a newly developed website in the Khmer language. And that too provides information as well as photographic examples of infant eye and vision conditions, including the important sign of that white pupil being a potential sign of retinoblastoma. And with the ongoing expansion of this project, we'll ultimately provide these resources to all paediatricians, general practitioners, and maternal healthcare workers throughout Cambodia. Now, while not specifically part of the Cambodian Eye Health Awareness Project, I thought I would include a success story from Cambodia. At 2 years of age, little Vinuth was examined by Dr. Lom Orm at the Khmer Soviet Friendship Hospital in Phnom Penh after a white reflex was noted in the pupil of his left eye. We can see a picture of Vinuth here on the left of the slide. He's smiling and holding his hands up to his face. Dr. Orm was trained as the first ocular oncologist in Cambodia, and her training was supported by Sight for All in 2020. Dr. Orm's examination showed that Vinuth had a large retinoblastoma tumour, filling more than 75% of his eye socket. Dr. Orm, together with other general oncologists from Khmer Soviet Friendship Hospital, instigated chemotherapy treatment. Within 2 weeks, Vinuth's condition unfortunately deteriorated and he was admitted to the ICU. Shortly after, Vinuth's parents made the difficult decision to proceed with the removal of Vinuth's retinoblastoma and his left eye. And this decision fortunately saved his life. The surgery went smoothly, and less than 8 weeks later, Vinuth was fitted with his new prosthetic left eye. He has retained vision in his right eye, and most importantly, he's alive and his retinoblastoma has been removed. The image on the right on the slide is of Vinuth and Dr. Orm sitting in close next to each other. Vinuth is grinning and looking off to the left, and you can tell Dr. Orm is smiling even though she's wearing a face mask. So now we're moving to Australia, where we've been implementing the South Australian Early Childhood Eye Health Awareness Project. This is an initiative to increase awareness of infant eye and vision conditions among primary caregivers and medical practitioners. Similar to our project in Cambodia, this project has required a tremendous amount of collaborative work between the South Australian Government Women's and Children's Health Network, the Adelaide Primary Health Network, and optometry and ophthalmology representatives. A big thanks must also go to Sandra for her assistance with this project since its inception. We have certainly appreciated the wealth of experience she's had in this area. Now, in Australia, parents are playing an increasingly active role in driving the referral process for their child's health needs. Therefore, our South Australian project has a greater focus on raising awareness of infant eye and vision conditions among primary caregivers. So our goal is to make this information readily accessible via digital and print formats to all parents and caregivers of a new baby. And to support this work, we're also liaising with our primary health networks to bring awareness to general practitioners and paediatricians. Now, the primary caregiver education campaign has involved the development and promotion of an educational webpage hosted on our Sight for All website. And this website has gone live as of 1st of July, 2021. So it's pretty fresh off the press. A link to our website has been included in the South Australian Child and Family Health Service website. The Child and Family Health Service is a South Australian government initiative that offers health services for infants and children 0 to 5 years of age. A QR code for our website will also be included in their Blue Book. Now, the Blue Book is a health and development record given to all parents of newborns in South Australia. We've also developed a print version of the summarised webpage information in the form of a brochure, and these brochures will soon be distributed to all 150 child and family health service clinics throughout South Australia. On the slide here are 2 images of the brochure, the front page and a snapshot of the inside of the brochure. The brochure highlights information about the stages of visual development and the warning signs of infant eye and vision problems, including some example pictures. Of importance is the middle image, which displays a young girl with leukocoria in her left eye, and an explanation that a white pupil is an important warning sign to look out for. Now, the last of our awareness projects that I wanted to share with you today is one that would probably be considered the most out of the box out of all of our activities. The short documentary, Little Bang's New Eye, is an emotive story created in Hanoi by director Lara Damiani. This unscripted and unplanned short documentary was created in the Vietnam National Institute of Ophthalmology in Hanoi, where Lara travelled with Dr. Muki in 2016 to document the work of Sight for All. The brief was open to find a story that can connect people to Sight for All's work and impact. The 14.5-minute film introduces us to Little Bang, who travels to Hanoi with her family all the way from their home village in order to seek specialist care from Sight for All trained ocular oncologist, Dr. Min Cho. And I believe she'll actually be presenting in one of tomorrow's sessions. So while I can't unfortunately show you the video today, I'll just give you a quick summary. Dr. Cho We see she diagnoses retinoblastoma in Bung's right eye, which requires treatment. And throughout the documentary, we also get to follow her journey as she's fitted for a prosthesis. We also get to learn about the genetic predisposition of RB and how other family members can be affected. Here I've included some screenshots from the film, which include on the left, an image of Bung in surgery, surrounded by 2 Vietnamese doctors, including Dr. Cho. And Dr. Cho is speaking with Dr. Muki, who is also providing support during the procedure. The image on the right is of Bung and her sister Vung, and they're having their vision checked by a clinician at the hospital. The sisters are sitting next to each other, and Vung is having a cover placed over her left eye to check the vision from her right eye. Now, this film was released in November 2017 and has been narrated by Australian actress Kerry Armstrong. The film has won 3 international awards and was the official selection into 4 international film festivals, all helping us to shine a light on the great work of the dedicated group of eye health specialists, as well as raising awareness of retinoblastoma. So to access the film, you can visit the Site for All webpage or find it on YouTube. And 2 links there I've included here on the slide for you to check it out. So thank you so much for giving me the opportunity to share with you all today. I hope you've enjoyed hearing about some of the work that Site for All are doing. And feel free to visit our website, siteforall.org, and our social media platforms if you'd like to find out more. And of course, please feel free to contact me directly via email if you have any further questions. So thank you.
Thanks, Jo. That's really exciting progress that Site for All are making in this space, and the approach to equitable global health is a goal we all strive for, and I look forward to seeing the impact of these initiatives. As you'll hear from my presentation later on, I think it's amazing, and I've really loved being involved with Site for All to produce the pamphlet that's going to be distributed in South Australia. I've always said my research seems to have had more of an impact everywhere else in the world, but in my own town. I'd now like to introduce Paula Dillon, a bereavement midwife and childbirth and perinatal loss educator. But importantly, she's a proud mum of Grace, whom we all heard her excellent presentation earlier today. Paula used to live in my hometown, but moved to much sunnier Brisbane some years ago. Paula is going to give us an update on some of the novel approaches to raise awareness of RB that have been introduced in Queensland. Thanks, Paula.
Thank you for this opportunity, Sandra and Marissa and the whole team putting together this One RB World 2021 conference, which thus far has been absolutely fantastic. I'd just like to begin by acknowledging the traditional custodians on the land of which I present today, the Turrbal people. I pay my respects to elders, both past and present. So while we're waiting for the slides to come up, there are lots of opportunities and different activities that we can do to raise awareness of retinoblastoma. And I'm going to show today just a couple of examples from Queensland in Australia. The first one I'll show shortly is a short video that was prepared for Retinoblastoma Awareness Week 2021 by the Queensland Children's Hospital TV channel, Juiced TV. Thank you for those slides. So I'll play this video shortly. So the video prepared for Retinoblastoma Awareness Week 2021 by the Queensland Children's Hospital TV channel, Juiced TV. The TV show made by the kids in hospital for the kids in hospital. The video is set in the hospital and depicts 2 little girls, Isabel and Elsa, holding large microphones like news reporters, explaining what retinoblastoma is. 2 ophthalmologists who work at Queensland Children's Hospital, Dr. Jane Camuglia and Dr. Jacqueline White, discuss the importance of raising awareness of retinoblastoma and how it may be detected by the appearance of a white reflex, leukocoria, in the eye or eyes. Dr. Jane also lists treatment options for retinoblastoma, and Isabel and Elsa give some suggestions of ways we can help raise awareness of retinoblastoma. The main message of the video is look for the glow.
Hi guys, my name's Isabel. This week is Retinoblastoma Awareness Week. What's retinoblastoma, you may ask? Well, it's a super fast growing eye cancer that affects babies and young kids just like me.
Early diagnosis is really important to detect the tumours early so that we can do the right treatment to save children's lives and their sight.
So we know one of the best ways to diagnose retinoblastoma is to take photos and look for any difference between the pupils of the eye. Typically, we would expect that the pupils appear red in photographs. However, with retinoblastoma, there can be a change where the abnormal pupil looks perhaps white or duller in comparison.
We have some really exciting new treatments available for retinoblastoma. These can include things like laser therapy or these really ice cold pen probes that we use called cryotherapy. Those are really helpful for treating the tumours. And then there are other treatments like chemotherapy, which is also excellent at treating these tumours.
This is why it's so important, now more than ever. Here are some ideas on how you can play your part. You can display an awareness message online, share what a white eye reflex is, and the importance of checking kids' eyes. You can even put up a poster at your work, community, or school.
Please join us in sharing this simple but important message that a white glow in a child's eye could be the sign of something that needs treatment, and early detection saves lives and vision.
Look for the glow.
Look for the glow.
Look for the glow.
Look for the glow.
Thank you for that. So you can see, you know, it's really great to get the kids' involvement in this as well. And we know that social media is a fantastic platform for sharing awareness campaigns and for other people to be able to see those campaigns, perhaps detect something in their child's eye or another child's eye to raise awareness as well. So another event that's happening in Brisbane is the Bridge to Brisbane 2021. Bridge to Brisbane is an annual fun run, and you'll get my next slide shortly, please. Bridge to Brisbane is an annual fun run over 10 kilometres or 6.2 miles, or 5 kilometres, 3.1 miles, held in Brisbane, Australia. Tens of thousands of people participate in the fun run, often with their partner, children, colleagues, friends, or even strangers, to raise funds for their chosen charity or to raise awareness of particular conditions, ailments, and support services. After competing in several fun runs over the years with her sister, Brisbane mum Kelly Perrin, who's pictured here with her partner Troy, their children 9-year-old Jack and 7-year-old Isabel, Kelly decided to enter Bridge to Brisbane in 2021 as a fun way of raising awareness of retinoblastoma. Kelly is mum to 7-year-old retinoblastoma survivor Isabel, who's pictured here with her big smiley round face and Bridge to Brisbane t-shirts and Know the Glow caps. Isabel was diagnosed with bilateral retinoblastoma in July 2015, around the age of 1 year. So Kelly, Isabel's mum, knows all too well how important it is that people are aware of the disease retinoblastoma, and that if picked up and treated early, vision can be preserved. Kelly invited past and present retinoblastoma families to the Know the Glow team, and she's hoping it can be something that we can repeat every year. The team of approximately 60 members so far also includes Queensland Children's Hospital ophthalmologist Dr. Jane Camuglia, who starred in the little Juice TV video before, and ocularist Nick Pools, and also for any Queensland retinoblastoma survivors, you will know all too well Professor Glenn Goll. I too am also looking forward to participating in this event with my daughter Grace and some of her closest friends who have decided to join the Know the Glow team this year. So events like this can be used for fundraising, but their purpose also goes beyond fundraising. They provide an opportunity for retinoblastoma survivors, parents, families, and also clinicians to gather as a community and network with those who have a similar lived experience. For example, my daughter Grace, who you have seen a couple of times earlier, was recently approached by a girl at her school who told her that she noticed Grace's name on the Bridge to Brisbane sign-up list and that her cousin is currently undergoing treatment for retinoblastoma. So this girl from Grace's school, very large school in central Brisbane, was able to ask some questions of Grace to help with her cousin's treatment as well. And just my last slide, please. So my last slide, what can you do? I can even point here at you. What can you do? Talk to your family, your friends, your colleagues, and think of some ways that you can help raise awareness of retinoblastoma. I love the topic of this presentation today, thinking outside the box, and you can see some examples of people who have done that. You may wish to source some ideas from awareness organisations such as Know the Glow. They've got a website and Facebook page. Awareness of disease and symptoms is essential for screening and early detection, because early detection and treatment of retinoblastoma can help preserve eyesight and life. Thank you.
I would like now to share with you some of my journey trying to improve the systematic awareness of signs of eye disease in my state, motivated by improving the timely diagnosis of RB. But as you'll see, I was required to do a PhD to do it. And anyway, this is my story. From inspiration to implementation, the never-ending story, and it certainly has been a never-ending story. It started in earnest in 2012 at my first One World conference, where I was challenged to think more deeply about delayed diagnosis of RB. I knew it existed even in my own backyard, but I'd never really actually thought about it, or let alone what a solution might be. And this is an image on the right of the note that I wrote in my little notebook that day in London, a glint or a squint, because that seemed like a really good little tagline for people to remember. This is the story of what happened next. We know early, or rather timely, diagnosis of retinoblastoma saves lives and even eyes. And as shown by the data here from my centre for the period 1998 to 2017, almost 90% of the time, the affected eye of a child with unilateral RB and no family history is removed because of the disease is so advanced at presentation, compared to none with a family history. Similarly, we have only removed 1 of 22 eyes of children with bilateral disease in this time period, and in children with a family history, compared to 45% of eyes of children with bilateral disease who don't have a family history. And this is because children with a family history of disease are being screened. So 85 to 90% of children actually rely on someone recognising the early sign of retinoblastoma, like a white pupil, like a squint. So first, what was the inspiration? My research was motivated by the positive outcomes of a study by Leander and co-workers and my now great friend Ligia Fu in Honduras, where they used a simple poster of a child with a white pupil, and it advised parents what to do if they saw this in their child. These posters were put up in community centres, much like what we heard from Petra earlier in the CHECT campaigns. So parents would attend these community centres when their child were being immunised. And what they found was that within 18 months of this program being implemented, the number of children presenting with disease outside of the eye, so extraocular disease, reduced from 73% to 35%. And that in turn resulted in an increased survival, where before the campaign, only around 14% of their children were surviving, whereas now it's around 48% at the time of this study. Now, parents in Victoria, where I live, are given a handbook when their baby is born. It has some information about their growth and development, and it also serves as a record for all their vaccinations. On the right, you can see the only page that refers to vision or eyes in this handbook, and there really is absolutely nothing about white pupils or strabismus. It does mention the red reflex test, that the baby will have that done in hospital, but nothing about why it's done, or importantly, what parents need to look out for. They also receive, in the course of the first 18 months of that child's life, they have 8 maternal child health visits, and they'll receive 31 pamphlets of information, but not one of them will include anything about eyes or vision. The only way parents in Victoria are going to know about RB or the early signs is what they see on the news, in print, or on social media. Now, there is an array of examples that have come across my feed through CHECT, We See Hope, Know the Glow, the list goes on. There's magazines, newspapers, all over the world. These, I guess they're nudges, really, reminders of information. But I actually believe that even though this is a really important way of keeping an important message going, I really think that parents deserve to be given important information, like what are the signs of a child's, that there might be a problem with their child's eyes, should be given systematically when their child is born. We know that from what Petra was saying is, people will recognise and remember a photograph or an image and store that in their mind. Now, receiving vital information like this cannot and should not be left to chance. So when I returned from London, I challenged the health department to include health information for parents, and then they asked me that I had to go and get the evidence. So the next thing I knew, I was on my yellow brick road with 4 supervisors in tow, trying to answer the question, if you tell them, will they know, in the context of a doctoral degree, which I didn't need, but apparently the project did. What I wanted to know was, if you give parents information about signs of eye disease, would they hypothetically change their help-seeking behaviour? Now, the first thing I learned on this journey was that there are lots of things you need to think about when you're developing effective health communication. Not only does it need to be easy to read and understand and have effective graphics, but the content also needs to be evidence-based and supported by a framework for behaviour change. And these were all new concepts for me to learn about, that who said you can't teach an old dog new tricks? So the framework I selected for this study was the easiest one I could find, called the Information, Motivation, Behavioural Skills Model. And what it relies on is 3 main constructs, where you give people information, if you give them reasons why they should do something and tell them exactly what they should do, you can actually change their behaviour. And those 3 constructs, either on their own or together with each other, can bring about behaviour change. Now, IMB theory is very conveniently applied in 3 steps, and that very neatly divided up my research project into sizable chunks. So the 3 main components are elicitation, intervention, and evaluation. So I had to find out what parents knew, develop the information pamphlet, and then test it. The first step was elicitation. So what did they know? I ran focus groups, and I wanted to document the what parents actually knew, what they didn't know, and what was misunderstood. I stopped after 5-hour-long or more focus groups. I was able to document a very clear lack of knowledge and misunderstanding around what signs of eye problems would, or rather wouldn't, worry them. And their comments were pretty telling. So comments around white pupils, such as, it's very easy to think that could just be the lighting, the camera. If you don't know, you don't know. Or, I've had it before with photos. I've really disregarded it as being the light thing. I probably would have disregarded it as the flash. Or in talking about eye turns, don't they grow out of something? They can look a bit cross-eyed early on and off, then they grow out of it. Or I don't know, I'm not sure. I wouldn't know if it would actually affect their vision. So after the 5 focus groups, I reached what was called saturation. So I was able to stop. And that means even though I kept running focus groups, everyone was saying exactly the same thing. So I was able to stop and start transcribing the audio recordings, which each focus group went for about 1.5 to 2 hours. And that's what I spent that summer doing. The analysis of the data established 2 overarching themes. One about knowledge, so what they knew or didn't know, where they got their knowledge from, and what prevented them from getting information, and help seeking. So what were the attributes for seeking advice that the parents had to have? What factors influenced their decision making? And what were the barriers and enablers to their help seeking behaviour? After analysing all the data, I set to work developing the information pamphlet. Who thought how this much work actually goes into this? The final version of which you can see on the left. And using the IMB framework, every piece of information that I included in the pamphlet was there because it answered a lack of information that came out of the focus groups that I'd run. Whether it was information about eye or vision development or signs of eye problems, whether it was motivating statements for the parents, such as children's vision is important, what you notice can be critical, as well as telling them exactly what to do, such as, you know, you can retake if you see a photo of a child with a white pupil, go on this, you know, click on this link and you can you can receive instructions on how to retake your photographs. I was really excited when the finished product landed on my desk at my institute, and to see what amounted to a whole year of work looked like had come to life. I then had to design a survey that I could use in the evaluation. I had 6 scenarios of different problems that a parent might encounter, so that it would be less obvious to them what the study was actually about, because I didn't want them going off Googling on the internet all about leukochorial white pupils and squints. The other scenarios included a woman's inflamed breast, so she had mastitis, a child's watery eye, a child with a rash on their leg, and a child with diarrhea. But the 2 that I was using specifically for the study was a scenario on a child with a white pupil in one eye. So the parent's taken a photo. They can't see the white pupil when they just look at it. It's just in the photograph, and that their baby's otherwise well and doesn't show any signs of not being able to see. And the parent is then asked how concerned they are. Not at all concerned, somewhat concerned, or very concerned. And the other scenario is about a baby with an eye turn. So there's a photo of a child with an eye turning in, and the vignette says some of the time you notice her eyes turning in towards her nose. So she's cross-eyed, she's not bumping into things or showing signs of not being able to see. And again, they have to answer what degree they are concerned, to what degree they are concerned. The next thing was the randomized controlled trial, which is exactly the same process that we go through as scientists to check whether any drug or intervention can actually make a difference to disease. So I sat in a waiting room of an antenatal clinic at the largest women's hospital in Melbourne and approached parents in the waiting room to see if they'd be interested in participating in a study about mothers' and babies' health. They didn't know that I was an eye person, and they didn't know that the project was actually about children's eye health or evaluating a pamphlet about children's eye health. All they knew was that they were going to complete a survey, then they would be randomised to receive one of 2 envelopes that contained either the pamphlet that you could see on the left, which is information about baby's play, or the pamphlet on the right, which is the pamphlet that I developed. the year before. So on the flow chart that you can see in the middle of the image, that's the way we represent how we actually go about doing a randomized controlled trial. So I invited nearly 700 people in the waiting room over 3 months. And of those, 518 women agreed to do the study. They completed the first survey, then they were randomized. They each received their sealed envelope, which they weren't allowed to open until they left the hospital, lest I find out which group they ended up being, because I had to remain blind or masked to who received what. And interestingly, well, not interestingly, but what happened next is about 2 weeks later, all these people received the same survey a second time, and I looked to see whether the answers to their questions were different. Now, what was interesting is that in the two groups, obviously there was the same number of people in each group, but almost the same number of people didn't return their second pamphlet, and 3 people withdrew from the study in each group as well. So once I had all the data and closed the study off, I then had to proceed with the analysis. I needed to enroll 520 people to give this study what we call statistical power, which means are the findings we observe in this study meaningful and representative? And this number included a 30% buffer for parents who might not return the second survey. I humoured myself with the countdown. I had a notepad crossing the number of people off all the way down from 1 to 520. And then I was becoming so delirious, I couldn't even add or subtract. So I was working it out on the calculator on my iPhone, and you can see some of the screenshots that I took in that time. And then I started getting really crazy, and I wrote the last 10 people I needed to enroll on my hand, and I crossed them off successively on that last evening. So some of the interesting comments while parents were filling in the first survey, and as I said, I pretended I wasn't trying to remember because I didn't want them to know that I was an eye person and that this was what the study was about. But, you know, comments like, I think I had better go do some research on eyes, or what is it with the white pupil? I would never have thought that was anything, but now I'm not so sure. I'm going to have to Google it. Can I Google it? And it was these sort of comments that they made that reminded me that getting this vital information pamphlet out to parents was really necessary. Now, because of the random allocation of the intervention versus the control pamphlet, parents in the 2 groups participated were actually identical. They were about the same age, so in their early to mid-30s, and most were tertiary educated. And a quarter of the group did not have English as their first language. It is a shame that, in fact, that this study, for this study, the demographic characteristics of the participants are very similar, or what we call homogenous. I would have loved to have had sort of younger participants, or people who were who might have had less formal education, and to see whether the pamphlet had the same sort of impact. But you can't control who says yes to participating in a study. Nonetheless, I'm not going to bore you with all the technical statistics. You can read those in the paper I published last year from this study, but essentially it showed that women who received my pamphlet and completed the repeat survey were more likely to be concerned about seeing a white pupil in their child, and would be more likely to seek help sooner than before they received the pamphlet. And for the question on strabismus or eye turns, that was really interesting, because the women that received my pamphlet weren't any more worried about eye turns, but I sort of figured that was because maybe as a community, we already know about eye turns, and eye turns are familiar to us, unlike white pupils. It's something we've never heard about. But what was really important is that the people that received my pamphlet were now more likely to go and seek help sooner rather than put off going to see their doctor. So I had all my evidence, and if I thought that was hard, implementing it was going to be even harder. After months of unanswered emails to the Maternal Child Health Service, which is part of our Department of Health, I discovered their Achilles heel. You see, they've got an app for everything, and the Maternal Child Health Service is no exception. And when I tested their app, I found that maybe it wasn't very useful, because when you typed in the word white pupil or white pupil in photo, it either said, I'm sorry, I don't know how to answer that, as shown in the image on the left, or on the right, it started describing the problems associated with the colour of baby poo. So I had their attention once I pointed that out to them. I got an interview with them and I met with them in May 2019. And my first meeting was with a policy advisor with the Maternal Child Health Service. And, you know, I was buoyed by the fact that they were interested in what I had done. They were really impressed with the evidence and research that I'd collected, and that it underpinned what I was asking them to do, because I thought it was clever. I made the pamphlet exactly the same shape and dimensions as the pages that already filled the handbook that parents were given. But alas, after this meeting, more emails went unanswered as I was trying to progress this process further. So after 6 months, I bypassed the Maternal Child Health Service altogether and I went higher up, and I sought a meeting with the Parliamentary Secretary for Health and a senior advisor for the Minister for Health. This time I took reinforcements with me, Megan Prichter from Cataract Kids Australia, because my project wasn't just about retinoblastoma, because they balked at me when I said, oh, only 4 kids in Victoria will get retinoblastoma in a year, and they couldn't understand why they needed to put this much effort into something that was so rare. So by including these signs as being something about, not just about retinoblastoma, but about diagnosing other eye conditions such as cataract, which is blinding, for me, you sort of got more bang for your buck, and you're sort of fishing with a net rather than fishing with a line. So Megan and I met with the advisors, who were both young parents themselves, which I think was really important. And they were clearly taken aback by the information that we gave them. So they arranged a meeting for me with someone higher up in the Maternal Child Health Service to progress the implementation further. We saw this as a win, and so Megan and I took a photo of ourselves out the front of the Parliament House with my pamphlet. After that, I had the meeting in November, and that was about a month later. And it was a really tough day because it really took a lot of convincing, because all I kept getting was why we couldn't do this, not why we could. The people I met were giving me lots of reasons why what I was asking them to do was unreasonable. The health book was about to be replaced with a digital format in the future, and all they were prepared to do was a refresh of that current page that I showed you earlier with the information about eyes and vision. And that was slated for February 2020. So they would allow me to modify some of the content, and I could write the refresh page as well as rewrite the information that they were putting on the app. After that meeting, I waited and I waited and I waited for some progress. And I really learnt that patience is not the ability to wait, but the ability to keep a really good attitude while waiting. But gee, it was really testing me. Come February, I had a small win. The app had been modified to now provide useful information with a link to the page at my research institute, where more information was available about children's eyes and vision was available, and particularly highlighting leukocoria and strabismus as problems that shouldn't be ignored, and where to go for more information. I wanted more changes though. How about a button at the bottom of the front page of the app that said your baby's eyes and what you need to know? Because parents wouldn't see this information that I'm showing you here unless they specifically ask the app the question, white pupil or white pupil in photo or strabismus in that app. So it only gave them information if they requested it, rather than bringing the horse to the water, I suppose, is what I was trying to do. Again, their silence has been deafening. They said my pamphlet couldn't be included as it was, even though I'd formatted it to the same size as the books, because it was too expensive. What I produced cost 7 cents on a print run of 5,000. So on a print run of 80,000, it'd be even less. Really, I said, is children's vision so unimportant and not worth more than 7 cents per child? I was absolutely floored. I did ask them that and I didn't receive an answer. The whole time in this meeting, my phone was pinging with calling me to head back to the children's hospital because I had a 4-week-old baby coming in that I needed to now support the family with on suspicion of having retinoblastoma. So it was really, really hard. They did agree to let me update the information in the book, which, as you can see here, I've added a little bit of text to that page, but I'm not allowed to have photos because it's too expensive, which I found really disappointing, especially in light of what Petra was saying earlier today, that parents remember what a photo looks like. They'll remember that. That's what sticks in their mind. So I will certainly be pushing that barrow continually. I gritted my teeth. The book was going to go digital, they reassured me, and there would be the possibility to include more information with links and images. So I needed to remain friends with them to ensure that I'm part of that process when we go digital. But, you know, there was something on the horizon called COVID and there would be a delay, and I'm now still waiting. Anyway, I've been determined that we need a multifaceted approach and we can't expect parents will get their information from only one source. And that came out very clearly to me in the focus groups that I did early in my research. And earlier this year, I was asked to review the content on one of the largest parenting websites that are in Australia, which is project managed by the very well respected Murdoch Children's Research Institute. And I thought, oh, while I'm here, let me have a look what comes up when I put in white pupil. And was I surprised? Not surprised. It was absolutely nothing. But what was really cool is that even though they had some information on squint, when I brought it to their attention at the Murdoch, that they really needed to update their website and include something on leukocoria, they are really excited that I can provide them with information, and we're actually in the process as we speak developing the page for this website. I cannot believe the journey I've been on. This has taken 9 years really so far, but I will carry on and I will try to keep calm. Okie doke. So that's it from me now. And I would like to introduce our last speaker for this session, Ligia Fu, who is a pediatric hematologist and oncologist from Honduras. Now, I first met Ligia briefly at the One World meeting in Dublin 2016, and we caught up again in Washington in 2017, and we parted great friends. In 2007, Ligia co-authored the only published outcomes study of the impact of awareness initiatives for retinoblastoma. And Petra touched on this earlier today, that you know, knowing what impact awareness initiatives have is really important to keep them going and to convince stakeholders that awareness programs are really important, because this is the impact that it can have. It has actually had, not hypothetically what it might be. Ligia is unable to be with us today, but please sit back and enjoy this pre-recorded presentation of where her team are up to and what progress they are making.
Good morning and good evening, everybody. I'm going to share with you guys about this talk. It's about the raising healthcare providers awareness in the virtual world. We know with the pandemic, we had to think out of the box and try to see how we can continue raising awareness about retinoblastoma in our countries. I'm a pediatric oncologist from Honduras, Central America, and I'm proud to be here and thankful to my friend Sandra Staffieri for the invitation. I want to first to let you know that I'm from Honduras. This is a small country located in the Central America, in the Caribbean. And unfortunately, we have 66% of population living in poverty and 45% of them living in extreme poverty. For that reason, we have families that maybe never will be able to reach a physician or to be able to know about what retinoblastoma is. And even though Honduras is a small country, we are located in the capital city where we are able to take care of the children with retinoblastoma, but the possibility of these families to be able to get to the hospitals is very difficult for them. The roads and the access, and as I tell you, the possibility for them to reach a doctor is very difficult. So we have to start thinking, what can we do for all these population, and to have the health care providers to be aware about this terrible disease that has to be diagnosed in a very early stage, so we are able to save the lives and also to be able to save the vision. So what we have done is to share during the special days for Childhood Cancer Day, that is in February 15, we use the media, we use the distribution of the flyers with the local Korea to be able to reach all the families, all the community, all the teachers, the physicians, all the people to know about what leukocoria is, and also that when you find a baby or a little child with leukocoria, you have to think about it can be cancer and it has to be referred to the hospital setting. These are the centers where we take care of the children in pediatrics, the children with cancer. They are located in the north and in the central part of our country, but the main, where we are located in the capital city, is the only place where there are trained ophthalmologists and pediatric oncologists that can take care of these children with suspicious diagnosis of retinoblastoma. In 2015, when we were not yet with the pandemic, we start having meetings with the leaders of oncology to trying to make a project about cancer awareness with the health workers, and in a very simple way, the way that is not only available, not only for physicians, but also for nurses, for social workers, for all the people that could be in first contact with a child with a leukocoria. With the help of the government, the health system in our country, and also with the help from our local foundation, that is the Fundación Hondureña para el Niño con Cáncer, with support also from a grant of My Child Matters from Sanofi Aventis Foundation, and also with the intervention of PAHO, Pan American Health, we were able to create a program and we reproduce documentation, guides, and manuals related to cancer awareness in a simple way, to reach all the primary care healthcare workers, not thinking only in doctors, not only thinking in nurses, but also thinking in teachers, in social workers, in the first contact that a person could have with a child who present a leukocoria. So, and make them change their attitude about this, not to think that it was a birthmark and that they didn't have to do something. They had to refer those kids with leukocoria. So we started, before the pandemic, we started training the trainers in different sanitary areas of the country, and we contact physicians, nurses that could be the trainers for the primary care health providers in different parts of the country. We also distributed manuals, guides for early detection of childhood cancer, and also we gave funds that we received from the grant from Sanofi Adventist Foundation, that the name of the program that they have to support us is the name My Child Matters, that is worldwide. And when you present a program, a project that could be helpful for the community, they support with that kind of grants. We started with the leaders, a pediatric oncologist, the foundation, the Secretary of Health. We start having meetings to convince them to collaborate with us, to have all the personnel, the primary care health personnel, to get involved in our workshops. Before the pandemic, we planned to do these workshops in a very frequent way, but everything was stopped because of the pandemic. So we had to decide how we could continue with all this program to reach all these health workers in all the country. So we think that all the difference that we have done has been through education, and not only to physicians and nurses, to the community. All the country has to know about leukocoria, and that's what we have been doing all these years. In that way, we are able to get all these children, receive these children in our centers with the leukocoria, and not with those huge masses that we used to receive in the past. We have taught also to the students, the medical students, about an app that is available in the mobile phones, that is very easy to download in their mobile phones. Is called Cradle, and they are able to download that in their own phones, and they are able to learn about leukocoria and how to detect it. The earlier way that they can detect it to our kids, we are going to be able to make a difference for them and their families. Since we didn't have the opportunity to do these workshops for the healthcare providers, thanks to the local foundation, they created a virtual platform. The platform contains all the information from the manuals and the guides that we created, and we started doing the workshops in a virtual way. And this is amazing because it's not only about education, but also we were able, with this link that the foundation created, we are able to record also the data from the patients that are referred to us. Here are pictures of the active virtual workshops that we are doing with all these healthcare providers, with the participation also with the leaders, not only the oncologists who give the talks, but also people from PAHO, and also from the Secretary of Health, and also from the foundations. This is a work of everybody that are very convinced and very dedicated to the cause of retinoblastomas awareness, that we need to improve these early stages of retinoblastoma. And this program, here I show you what the manual has, and it's very easy. IEPI is a way how to diagnose by asking, doing the questions, the observation, and the evaluation of the child. And this is a simple way where that the healthcare provider, the primary healthcare provider, can be able to detect when there is an alarming leukocoria and has to be referred to our health center. And this is like a green light. And with leukocoria, there is no green light. There is only yellow light and red light. At the moment that you detect a leukocoria, we request for the referral of the kid to our oncology setting, where we have an ophthalmologist to be able to detect that it could be a cancer, but also there could be another diagnosis that also the ophthalmologist has to be taking care of. Also, we do this spreadsheet that is it's like a checklist that the healthcare provider is able to fill. At the moment that he refers the child, he comes with this sheet and to our unit, and we are able to know that this personnel has been trained by us in a virtual way. And also, once they have this workshop with us, they become part of a chat room where we are able to have collaboration between all these group of people. We collaborate with them, sharing experiences, sharing their questions, their doubts, and helping also the families how they can reach the units in care, in the case of they don't have the money to be able to go to the hospital. And in that way, the foundation, our local foundation, helps them, providing all the transportation for them to our hospital. Here also there is a participation with in the residency program that trains the pediatricians, and we have done research in our local setting. Our hospital is an university hospital where the students for medical degree and also for pediatrics, they are our students, and we train them also about retinoblastoma. And this is one fellow who is presenting the recent research that has been done about retinoblastoma in our country, and the objectives and all the activities. This was given recently to all the community, the medical community, for her degree of pediatrics. And this is the report that she gave, considering all the information that we have in our archives in our hospital of all the cases of retinoblastoma that we receive. And these are recent data that we are sharing about that. The more education that we give, the earlier stages we are receiving our children, and that's a very it makes us very happy, because it means that we are saving more lives. Now I want to share with you, all these people are the group, the pediatric oncologists in different health centers, and also the ophthalmologists who were trained by the ophthalmologist from St. Jude Children's Hospital to help us on the care of the children with retinoblastoma. We have very old equipment, a red cam, and also laser that needs to be bought, but because of economical situation in the public setting, we haven't been able to improve those equipments. But we know that cancer awareness, retinoblastoma awareness, and in the way that we are able to have earlier stages of our children with retinoblastoma, we are seeking to be able to save more lives, and that's the aim of it. And I thank you very much for your attention. This is the first child that we diagnosed with retinoblastoma a long time ago already, and with all the limitations that we have, but we feel very proud to be able to save the life of this child, and also more child that we have had since we started with this project. Thank you very much for your attention.
Oh my God, you know, I hope you all think that was as amazing as I did. I've already watched that presentation several times before today. I helped Ligia tape it during the week. And, you know, I'm envious of how well the team in Honduras have been able to engage their key stakeholders in that country to progress their goal. When I think of the challenges I have faced here, I swear I'm sending this presentation to them. I now invite you to ask a question or make a comment in the Q&A of any of the speakers who are present with us today. So that's myself and Paula and Joe Croft. I think what's really interesting, if I can just pick up on sort of Petra's presentation and all the activities that CHECT have been doing, and being able to use social media as a much more cost-effective way of achieving awareness. I think that's been a huge bonus. And recognising that there are lots of different ways to do awareness, that it is I guess, a moving beast. And we just have to keep working at it. And it's not something that you just do once and away you go, much like any other health campaign, whether it's breast cancer awareness, or whether it, smoking awareness, that took years to get off the ground, to get that sort of stuff. And I guess I'm just really impatient. Lucky I'm a Taurian and I'm stubborn. But yeah, I think it's amazing at what other people are doing. And I guess it's also important for people from other parts of the world to recognize that you don't need to reinvent the wheel. Get in touch with us. Everybody is happy to share resources. All you need to do is tweak it, bring in ethnically or culturally appropriate photographs that suit your demographic, and the job's done. But it does take manpower, it does take work, it does take effort on the part of somebody. So having the resources of people is also really key. You need money, but we need people to push that health message.
Okay, we do have a couple of questions. So first, for health workers, what are the effective ways of creating awareness of RB among them?
Okay. That's a really good question, because, I have focused to this time all my attention on parents, because in my mind, we need to get the parents first to notice the problem before they get to the health workers. But alongside that, we need to have the health worker that they go and see to actually take notice. And we do know in this community, and I've been listening to it for years, and it's even published, that parents will go to a doctor and their concerns will be dismissed. And that is a very real problem. There was a very nice paper out of Jordan early last year, I think it is, that looked at trying to demonstrate what knowledge the health workers, like doctors and pediatricians, newly graduated medical people, have about if a parent brought a child with a white pupil, how they would respond. And I guess it's about building the evidence that we need to remind them. We know the whole RB is too rare to care, but it's not too rare, because here is a community that is huge, that it is a huge problem. And just because it affects a small amount of people does not make it less significant. I think people here might have heard me talk before about the fact that, we put retinoblastoma right on the top, but there are lots of eye problems that present with an eye turn or with a white pupil, and they're all important, and they all should be diagnosed and treated early, because the outcomes are always going to be better. But retinoblastoma is the most important one, because it could be potentially fatal. Joe, I think you have been doing some work in Sight. I think you talked about some work that Sight for All are doing in getting in touch with health workers.
Yeah, definitely. So we, it's still very much in the planning stage, and one of the ideas we're looking into, and similar to what Dr. Fu was sharing about this virtual webinar setting like we're in at the moment, is a really effective way of discussing this with health workers, and even hosting a package of education that I guess there's a incentive for health workers if they get some sort of continuing professional development points or hours, clinic hours that they can use from that talk is also good if they have another incentive, not only with the important information. So we're hopefully looking at doing like a refresher webinar for all of our maternal health workers through the Women's and Children's Health Network. Watch this space.
Yeah, we had locally, we had a meeting with the head of health education for GPs who have a special interest in children. And look, he was really helpful, and he gave us some ideas, and he really did put me back in my box and said, well, you know, I understand what you're saying, but, you know, GPs are just so overwhelmed and they haven't got time to stay on top of everything. And he did give us some ideas of how we might be able to keep that message at the forefront of their minds, and trying to update information that on a website that they would refer to regularly. But yeah, I think it's lots of different ways, you choosing lots of different ways to achieve the same goal, I guess. And those ways will be different depending on where we are in the world.
Yeah. Okay, we have one last question, and we don't have a ton of time, but this is really important. Abby had asked about ways that we can work together as a global community to sort of capitalize on those digital tools that are coming out, social media and connectivity available to us in order to raise awareness. So maybe if we could just briefly talk about how to work together.
Joe? Paula?
Well, I've already learned so much from this worldwide conference and from the speakers just over the last couple of hours, which has been great. And yeah, this virtual medium in which we can be having conversations with people all over the world. And like Sandra iterated, we're working to the same goal. So when we get a similar idea, let's find out what else has been done and not have to recreate the wheel, but use each other's resources.